We have our guest in the studio. We have Dr. Amand Leone with us, who has done everything in his life. He's by training a radiologist. He's an attorney. He has gone to MBA, and I think he's done everything except being a urologist, and he lives it up to me. So pleasure to have you here, Dr. Leone. And you know, October is Breast Cancer Month, and there has been always this debate whether women should go for screening or not. I think Angelina Jolie has had a huge impact and a factor 20% higher numbers of mammograms and testing as a result of what she's done. Should women, what's the discussion out there and the confusion about mammograms?
So, well, first of all, thank you very much for having me here to talk about this very important topic. I mean, what no woman wants to hear when they're diagnosed with breast cancer is, you know, when they ask how bad is it, well, it's been there for a while. And for women in their 40s, this is a real quandary because the screening recommendations are all over the map, anywhere from starting at 40 to 50, 1 to 3 years, or not doing it at all. So women really are confused about screening recommendations, especially in their 40s. Now,
the American Cancer Society and certainly U.S. Task Force constantly talk about the number 50, which no women out there is listening to this. And apparently the baseline mammogram should be done at 40. So that.
Well, here's the problem. Certainly when women get to age 50, breast cancer screening with mammography is effective. The breast anatomy is more fatty and will show cancers. Under 40, we know that mammography screening is very ineffective because the breast is too dense. The question comes in the 40s. And women in their 40s have to really weigh the risk of having an unnecessary biopsy, which is probably in the 70-90% range, versus having a positive test for cancer. It's maybe 30%, 20% chance. Now, screening picks up asymptomatic cancers before they are palpable or clinically significant. So the question is, do you try to find them before they're discoverable, or do you wait for a lump? And the recommendations seem to indicate that in the 40s, it's a question. Some advocate screening. Some say you wait till you feel a lump.
Well, why don't we try to get MRIs? If there's any question and the breast is too dense and you can't see, there's 3D mammograms, there are MRIs, there are other studies that can be done to really detect it. We know that when breast cancer is found at early age, just like, by the way, as you know, in my field of urology, prostate cancer and breast cancer, they go parallel. Both of them are about 230,000 incident a year. About 35,000 die from this disease, 1 out of 7, 1 out of 8. These two diseases are parallel. And when we find prostate cancer in younger men, or you find breast cancer in younger women, they are more aggressive, especially among African Americans. We think that these mutations and biology, it really has a lot to do with it. So why don't we get other screening tools to find out if there's something there before they spread?
The other tests you mentioned, MRI and these other 3D mammographies and stuff, the problem is that they're very sensitive but not very specific. So you find a lot of things that raise a question of cancer, and when you go in and look at them, you find that they're not. You create a lot of anxiety in these people while they're waiting for their biopsies. There's the cost, there's the scarring. So if you really look at it, you have to screen about 300 women over age of 50 for 20 years to save one woman from dying from breast cancer, but you will do 10 unnecessary biopsies on other women.
Okay, what if you have family history and you have like genetic components and you're at high risk of real breast cancer and ovarian cancer like Angelina Jolie? What do you say about that?
Well, that's a very special category. First of all, just the family history is very important for your physician to take because you can pick up on relatives that have had breast cancer premenopausally. That's a high risk factor. Then you have the BRCA genes, BRCA1 and 2. And if you have a family history for that, then you have to be very aggressive. And then I would argue that it is worth going to the very sensitive testing, the MRIs, the extra costs, the anxiety that goes with it, because you're going to have that anyway, knowing that you're at very increased risk.
Yes.